affected parts. And he even had frequent micturition since 5 to 6 months, with sore throat since 1 year on and off due to allergic rhinitis. He has weakness and drowsiness more towards evening, aggravated by movement exertion since 1.5 year, disturbed sleep since 2 to 3 months, and weight loss since 3 to 4 months. He has lost 8 kgs in 3 months. He has past history of frozen shoulder since 2 years, and he even suffered with COVID-19 in 2020, which was treated by allopathic treatment and got relieved. And he even has frequent allergic rhinitis. Family history has father with diabetes mellitus and hypertension, mother has hypothyroidism, grandfather has hypertension, grandmother has osteoarthritis, brother has DM and hypertension, sister has osteoarthritis. He prefers vegetarian diet. He takes 3 meals per day, drinks 5 to 6 liters of water per day, and he is especially thirsty at night. He desires cold drinks and cold food. Bowels are satisfactory. Urine frequent micturition is there, as I said, his chief complaints. And sleep is unrefreshing because due to frequent micturition and thirst. And he has perspiration, which is profuse and non-offensive. His mind symptoms are anger when someone doesn't obey what he says, quarrelsome, and he gets into an argument very easily, forgetful about the things said to him, and he keeps his stuff somewhere and he forgets his things where he has kept. He has dreams of dogs chasing him, and there is fear that something will happen to him, and he is anxious about his health. His basic parameters are normal, with temperature measuring 97 degrees Fahrenheit, pulse measuring 74 beats per minute, respiratory rate is 16 cycles per minute, and blood pressure is 130/90 mm of Hg. Other systemic examination, his cardiovascular vasculatory system was clear. S1, S2 was heard clearly. Respiratory system was air entry bilaterally equal and clear, and abdomen had occasional gas and distension of abdomen. He was conscious and oriented. When examined on his right shoulder, he had pain and tenderness on examination. He even had scapular winging on right side from lateral and posterior view, limitations on both passive and external and internal rotation of the right arm. Differential diagnosis being frozen shoulder, rotator cuff tear, and type 2 diabetes mellitus. Investigation, when investigated, his first investigation had HbA1c 12.5 and blood sugar level fasting was 659. The second investigation had HbA1c of 8.5 and blood sugar level as random 116. Third report was blood sugar level was fasting was 90 and blood sugar postprandial was 73 and HbA1c was 6.5. My final diagnosis came to frozen shoulder with type 2 diabetes mellitus. Thank you.
I think she has done well with her presentation. Now may I request Dr. Abhay Kulkarni sir for his expert opinion.
Yeah, the case she presented was good. I think it was a pretty clear diagnosis of frozen shoulder with diabetes mellitus. And I did not understand what treatment she gave. So these, so can she please repeat the treatment?
Sir, I have treated the patient with homeopathic medicines.
Okay,
Like,
what was that?
the medicine name should I give you?
Yes.
I have given him constitutional medicines with mother tinctures.
Okay, so what was his constitutional medicine according to you?
His constitutional medicine, causticum, and the mother tincture I gave him was syzygium.
Okay. So how was the improvement in frozen shoulder?
Frozen shoulder was good, sir, and even his reports came. Reports were good. After every 3 months, I used to check, and the reports were good.
Okay. Okay. So good. I think you have done well. And where the diabetic medicine, modern allopathic diabetic medicines were continued with this?
Yes, sir. The diabetic medicines were continued, and
Continued.
which were tapered gradually.
So since how many days is he off the medicines, of diabetic medicines?
This is a 2 years old case. Right? Till date, he has not come to me for the treatment.
Okay. Okay. So, does that mean that he is not taking the medicines, allopathic medicines, or he is not taking your medicines?
He is taking no medicines right now in my information, sir.
Okay. Is he a regular patient of your hospital?
Yes, sir. Yes, sir.
And does he visit for other reasons, or he does not visit the hospital at all?
He visits for another reason, like for allergic rhinitis, he comes.
Okay. Okay. So I think this is a good case and good presentation. Congratulations for treating such patients successfully. I think what we need to do is, according to me, everyone should believe in his or her own science and try to treat the patients accordingly. Um, because according to me, diabetes mellitus is a very vast disease and it presents in many ways and it has long-term effects on the body. And with only one approach, it is not possible to control this disease with one approach. And I think multi-treatment approach is especially good. In my science, according to Ayurveda, we focus more on the systemic part of the disease. Um, Madam, what is expected? Should I give the opinion on her
No, sir.
treatment?
So we want Ayurveda view about diabetes mellitus. Like
Okay. So
treatment
can I
and
share my screen about Siddhi?
yes.
Okay. Hello.
Yes, sir.
Is my screen visible?
Yes,
Yeah,
yes, sir.
it is visible, sir. Yeah.
Okay. Okay.
Not to me, Pan. I'm not able to see your screen.
Uh,
Uh, okay.
Okay, but you can continue, no
Sir,
problem.
No,
we
but
can see the screen.
I would like all of you to see the presentation because, uh, yeah. Is it visible now?
sir, it is
Yes,
visible,
yes.
but screen is blank.
Screen is blank.
Back, yeah. Slides are not visible.
Now it is visible.
Now it's visible. Yes, yes.
Oh,
Now
sorry.
it's visible, yes.
Sorry. Again, I think I have to share.
Yes, yes.
Hello, Kale.
रिटर्न तो मीटिंग करते
पण मग हे चालू आहे.
Is it visible now?
Yes,
Yes.
sir.
Yes. Okay. So, according to Ayurveda, it is very essential to understand the concept of Madhumeha. Yeah. So according to Ayurveda, I will focus on the Ayurvedic concept of Madhumeha. Okay? Yeah. We all know the current status of diabetes, so I would like to skip the earlier slides. So according to Ayurveda, up till now, we practitioners have been banking upon traditional knowledge, but we need to move beyond what next and to improve and expand the understanding of Ayurveda. The fact is that in Ayurveda, almost every text has elaborately described Prameha. There are hundreds and thousands of kalpas are described in text, but not all of them are in use. There are only very few medicines of Ayurveda which are used. So this has happened because we try to see the things with others' eyes. Uh, According to us, Ayurveda, we have moved away from the basic and we have stopped believing in our science. As we say, Shastram Jyoti Prakashartham Darshanam Buddhiratmanaha. So the science should be used as one part of the eye and our intellect should be used as the other eye. And with both the eyes, if the physician treats, then it is very unlikely that he will make mistake. So my today's presentation would be to understand the gap between reality and the understanding that we have and the description and actual use. So today I'm going to concentrate on the missing link between the information that we have on regarding diabetes in Ayurveda and what happens in the practice. So I aim to decode the knowledge from Samhitas, from going back to basics and gaining fresh perspective. So according to Ayurveda, what the problem we have is high blood sugar. Most of the times it is accidentally detected with no signs and symptoms. Now, according to any science, if we don't use other like blood sugar or other means, according to Ayurveda, most of the diseases are diagnosed according to the clinical presentation and the signs and symptoms that we observe. In absence of any clinical symptoms, signs and symptoms, we are technically in a tight spot. Academically, scientifically, and logically correct situation for diabetes, according to Ayurveda, is badly needed. We have two problems. One is diagnosing and treating the condition of high blood sugar with absence of signs and symptoms, and controlling the blood sugar level in patients having symptoms of Madhumeha, according to Ayurveda. So our graduates normally, we find that there are many synonyms. There is Prameha, we call Prameha as diabetes, we call Meha as diabetes, we call it Madhumeha. Whether should it be called diabetes alone? What if we consider any disease, what are its types? What do we do with the blood sugar? What do we think about the complications? What do we, certain major complications and minimal complications like fungal infections, low libido, etc. So what is our approach we need to do? So temporarily, so what is according to Ayurveda, there is one very famous quote of Ashtanga Hridaya. It says that Kale nopekshita sarve yadyanti madhumehadam madhuram yaccha meheshu yaccha sarveshu prayo madhviva mehati sarvepi madhumehakhya madhuryaccha tanorataha. Now the last word is very important. Madhuryaccha tanorataha. There is excessive sweetness in the body. Sweetness in the blood, excessive increase of sugar level in the blood. So everything that, whether it is with symptoms or without symptoms, everything should be called as Madhumeha according to Ashtanga Hridaya. Kale nopikshita sarve means chronically it happens that there is sweetness in the urine. That's why how it is called as Madhu and Meha. Then all over the body, because sugar is present, according to Ashtanga Hridaya, we should call Madhumeha. So Prameha, Madhumeha, everything, diabetes is everything is referring to the same thing. Now, as in allopathy, we have a diagnosis like type 1 diabetes, type 2 diabetes, gestational diabetes, and many other types there may be there. That is not my area. But in the same way, Sushruta has described Madhumeha of two types. Sahaja, like two premise, Sahaja and Apathya Nimitta. Sahaja means it is there since by birth. Hereditary, it is there, so it denotes type 1. And the other is Apathya Nimitta, because of wrong lifestyle, the other happens. So the description is also very similar. I wanted to highlight this. Tayoho purvena upadrutaha, krusho, like thin, dry, lower eating capacity, thirsty, weak, restless. This is the type 1 type of diabetes. And the other one, like Sahaja, and other one is Apathya Nimitta, is obese, heavy eater, high lipids, mostly lazy, lethargic. Like Uttarena Stulo, Bhavashi, Snigdaha, Shayasana, Swapnashilaha, Prayana iti. So our current understanding is I mean, after explaining the similarity, I would like to now go to the difference that Ayurveda has regarding. Before that, we'll quickly go to the current understanding. Diabetes is a condition of hyperglycemia due to impaired function of insulin. Now it is related to pancreas, islets of Langerhans, and diabetes as a disease of insulin and pancreas. It is called as. So according to Ayurveda, the breaking news is, according to Ayurveda, Madhumeha is a disease of kidneys. The origin of Madhumeha, according to Ayurveda, is from kidneys. I'll support the references. This is a reference again from Ashtanga Hruday. It says that Kruchran marmas adhomukhopi bastirhi mutravahi siramukhihi parshvebhyaha puryate sukshmahi sandyamanai ranaratam Yaistereva pravishainam dosha kurvanti vimshatin mutra ghatan pramehanscha kruchran marma samashrayan. So marma is a vital point. There are three vital marmas in according to Ayurveda: brain, heart, and the kidneys. And the Ayurvedic acharyas have attributed the prameha or diabetes or madhumeha to the kidneys. Now, Sarvesham Punarmutra Roganam Adhishtanam Bhatti, all Basti, all the site of all urine related diseases is Basti, and it is described in the Marma chapter. This is another reference of Ashtanga Sangraha. So this it says that the Basti, normally Basti is translated in Ayurveda as a bladder only, but the bladder cannot, it's a reservoir, and it is there are references that clearly in one reference to Vrukka and Basti are also mentioned. So here Basti Marma is referred to as kidneys, like kidneys, ureter, and bladder. The whole apparatus is described as Basti Marma, and it is said that it is the Mutradharo Ambuvahanam Sarvastrutosam Udadiriva Apaganam Pratishtha. Like all the fluid channels, it's the end point of all fluid channels in the body. So again, it is taken very seriously. This Ashtanga Sangraha reference I would like to quote. It's very important. Sarvajatvat Mahamarma Samshrayat Anushangataha Subahu Upadravacha Prameho Daruno Gadaha. Sarvajatvat means it is said to be created by all the doshas, like Vata Pitta Kapha. Either some diseases are only Vata, or Vata Pitta, or Kapha, or Vata Kapha, but such diseases are of all the three diseases. That means it is very serious and it is very difficult. Mahamarma Samashrayat, Bastyakhya Mahamarma. I mean, it is related to kidneys. So that's why if it is a disease of kidneys, then it is very difficult to completely cure. Anushangataha, that means Swabhavat eva dirgha kala anushangavan. By nature, this disease is designed to be for a long term, and it will not go away. And Bahu Upadravacha, it is known to have so many complications. So this explains the nature of Madhumeha that Ayurveda has described. And Tasmattam Yatnena Sadhayet, so that we should do all effort to treat such and very fast. So the basic issue is blood glucose levels remain raised and body cells are unable to utilize it for the needs. Now, I would like to present a certain different application of Ayurvedic principles where I have been able to decode the condition of hyperglycemia without symptoms. What should we call them? What should we diagnose them? So has Ayurveda considered hyperglycemia? Yes, not only hyperglycemia, but condition of prediabetes is also considered. Complications arising out of hyperglycemia are also elaborately mentioned. Microinflammation and microvascular complications are also addressed. And in a chronological order, starting treatment and consequences, if not done at the stages, is also described. So this is very important. So this is a stage-wise treatment that I have compiled from various different texts. So in the pre-diabetic stage, the Prameya Chikitsa, all the Kashaya and Apatarpana type of treatment must be given. Other people might not understand, but I would like to make a reference here that there are certain Kashayas are described for each type of Prameya, especially Vataja, Pittaja and Kaphaja in all the Samhitas. Those should be given in the Purva Rupa stage. Then if we do not do evam akurvataha, if such treatment is not done, the person continues having sweets, then the person's urine, sweat and kapha is sweetened. Like the diabetes, the symptoms of diabetes are presented and it becomes prominent at this stage. Along with the previous treatment, Vaman and Virechana are needed to be done. So in the same manner, if doesn't happen, if such treatment is not done at this stage, the condition progresses, then the muscle tissue and blood gets vitiated and causes microinflammation, which is addressed as Shopha. And Shotha, here there is Shopha and Shotha. There are two conditions. Here Shopha is mentioned, which refers to inflammation, and Shotha refers to edema. So even if such treatments are not done at the microinflammation stage, then it increases to a great extent and resulting in structural or organ-specific abnormalities. Evam akurvata shopho vruddho atimatram rujo vidaham apadyate tatra shastra pranidhanam uktam vranakriya upasevacha. So if what happens, then certain organ damage or tissue damage like diabetic foot, carbuncles, retinopathies, nephropathies, atherosclerosis, where surgical intervention becomes necessary. And this stage needs to be treated with treatment described in Vrana Chikitsa. Again, if such treatment is not done, then there is sepsis. Evam akurvata tasya puyo abhyantaram avadarya utsangam mahantam avakasham krutva pravruddho bhavati asadhyaha. Tasmad aditaha eva pramehinam upacharet. Hence, if such treatment is not done at this stage, there is sepsis and tissue destruction, and the disease becomes incurable at this stage. Hence, diabetes should be and must be treated seriously in early stages. So this is the compilation of first stage is prone to diabetes. Even before pre-diabetes, prone to diabetes condition is described, pramehi bhavishyati, and it is described in Medoroga Sthaulya. Pre-diabetes, the chikitsa should be of Medoroga and Sthaulya, predominantly Vihar chikitsa. Pre-diabetes condition, we should do Vihar chikitsa, Dhatri Nisha and Arogya Vardhini. Diabetes mellitus, if there is there, then it is Vihar chikitsa, Dhatri Nisha, Arogya Vardhini, Chandraprabha, Ayaskruti. So in such conditions, I have compiled the stage-wise treatment of diabetes as is described in the Samhitas, and such treatment is in practice in our institute and in my clinic. So here, to understand the concept of diabetes, hyperglycemia without symptoms, I have used the concept of Bhutagni. According to Ayurveda, there are 13 types of Agni in the body. One is Jaఠaragni, which is responsible for the digestion. Then 7 Agnis of the tissue, that is Dhatwagni, which are responsible for metabolism of all the tissues. And the most important part is metabolism of Panchamahabhutas, the 5 basic elements. Those are called as Bhutagni. What happens in hyperglycemia? Madhur Rasa, which is according to Ayurveda, it is formed from Prithvi and Apamahabhuta. Sweet substances have a dominance of Prithvi and Apamahabhuta. When these substances enter the body, they need to be digested by their respective Bhutagnis, that is Bhaumyagni and Apyagni, the Agni of the earth and of water. So in blood sugar, why there are high blood sugars? Because if they are digested very well, then only Madhurya of this substance will be utilized. But due to Bhutagni Mandya of Bhauma and Apyagni, they are not digested properly. They are not utilized. In a normal patient, the blood sugar is increased after the meals. and the blood sugar is there, and after 2 hours the blood sugar comes back to normal because their madhurya is utilized. But in such patients where hyperglycemia is there, even after 2 hours, and they do not have any symptoms because they just have bhutagni mandya. Agni mandya is not incurable, or Agni mandya is not anushangik. This can be treated. So hyperglycemia without any symptoms can be treated on the basis of bhutagni mandya. This is what happens in diabetes mellitus, and the start of Agnimandya, Bhaumya and Apyagnimandya, but it is not capable yet to develop any symptoms of disease. Hence, there is absence of signs or symptoms. Now, we don't have any, Ayurveda doesn't have any test to diagnose whether it is Bhutagnimandya or not. But we can use the test of blood sugar to diagnose the condition of Bhutagnimandya. And on the basis of Agnimandya is treatable. If we treat Agnimandya at this stage, as I have described in the other stage-wise treatment, then it is very possible to reduce the blood sugar levels also. So this is an aspect of how Ayurveda treats this. Using this concept, we can now diagnose such patients as Bhutagnimandya, treat Agnimandya, and this condition can be temporary and hence curable. Now, this is there are other aspects of grossly impaired Bhutagnimandya also can give rise to permanent and long-standing high blood sugar if that is not treated at that particular level. So this also explains the complications of diabetes. I would like to address the issue of impotency, like low libido. Apyagnimandya and Madhurya stage utilized, Madhur Rasa is not formed, resulting in Shukra and Ojakshaya, and Shukra Kshaya Janya Klaibya and symptoms of Ojakshaya are seen. Now, why renal failure occurs? Madhur Rasa is responsible for growth of all the tissues, which is not properly digested due to Bhutagnimandya. Vrukka is formed from prasada part, that is good part of Meda and Rakta. Meda, Rakta, Kapha, Prasadat, Vrukkau. So, and this Madhurya, because it stays in Ama condition, then Vrukka is not, the nourishment of Vrukka, or that means kidneys, is not proper. Long-standing, Meda is also the most vitiated dhatu. Long-standing and severe Bhutagnimandya can lead to Vidaha, that is microinflammation of all tissues and vital organs, which can lead to destruction of some cells or tissues. So this is, according to Ayurveda, it is called as the Vikalpa Samprapti or Amsha Kalpana of Bhaumyagnimandya. And if extended to other dhatus, it can give clarification of many more things. So here I would like to end my presentation, and I would like to give another aspect of how Ayurveda's principles can be applied in the clinical aspect, and how we can extend the understanding of extend the horizon of our understanding according to Ayurveda and treat such patients. According to me, there is a vast epidemic of diabetes, and we will need more hands to treat. Not just one pathy or not just one doctor is not enough. It should be a collaborative team effort for every diabetic patient. I think there are many more slides also, but I would like to give chance to others also. So I would like to rest my case here. And Ayurveda has got a tremendous base of philosophy, and Ayurveda has its own concepts which can be used and to diagnose, and with using all others we can have a nice collaborative approach. Thank you. I thank the university authorities, especially Karle madam, for inviting me as subject expert, and I congratulate the presenter. She has done really well, and she has stick to her science, and she has used her science very well. So congratulations to her. Congratulations to her guide and her institute, and to the university for arranging such a nice program. Thank you very much.
Thank you so much, sir. Almost covered all aspects of diabetes as per Ayurveda. Dr. Abhay Kulkarni, he is a professor and head of Swasthya Vritta department from Ayurved Seva Sangha, Ayurved Mahavidyalaya, Nashik. And he is a researcher for many diabetic projects, many diabetic trials he had conducted successfully. Thank you so much, sir. But please stay with us for further discussion.
Sure.
Now, I will invite Dr. Mrunalini Kelkar. Am I audible?
Yes, ma'am.
Okay. Dr. Mrunalini Kelkar. She is a senior diabetologist and physician from Nashik. She is a director of Kelkar Hospital and she is ex-professor from Vasantrao Pawar Medical College, Nashik. Ma'am, welcome.
Yes. So shall
I
I
would,
start, ma'am?
Madam, before you, I would like to add Dr. Mrunalini Kelkar is a very respectable figure in the field of medicine and diabetes, and she is a very knowledgeable lady, and I am proud to be her student. And thank you very much, Madam. Welcome to It's an honor to hear you.
Thank you very much, Dr. Abhay Kulkarni, really for your appreciation. First of all, I will thank the Shrestha. She has done a very good presentation and she has described how she has treated in her pathy about this frozen shoulder with diabetes. I thank Carly Madam for giving me this opportunity to interact with the students regarding the diabetes management. Then again, Dr. Abhay Kulkarni has given a wonderful overview of diabetes, Madhumeha, in an Ayurvedic perspective. Now we'll go ahead and we'll see the what is basically why there is an increase, because he said, Dr. Kulkarni said that there is a rise in diabetic patient in a tremendous way. So we are in and out, we are seeing diabetic patients in all strata. Previously, it was a disease of only well-to-do patients, but nowadays, from poor to well-to-do patients, we all see diabetic patients. So what is the reason? People really wonder why in India there's so much of rise in diabetic patients. So what we feel that basically there is so much of change in the food habits. You have seen, because when we were children, what we used to eat was totally different. And nowadays, the children and the youngsters are eating more refined food. And that is the reason. So you get lots of calories in, but the exercise is definitely has gone down because of this advent of all these, various vehicles. Then there are so many good things are happening in our life. So the physical exercise definitely gone down. And then, so the in is more, the out is less. And the problem is weight gain. And the weight gain is, just sir said, that about not only the full weight gain, but it's more on abdomen. So people sometimes may feel I'm not that overweight, but the abdominal circumference tell you whether patient is overweight, and central obesity is a major cause of insulin resistance, which will cause diabetes. Then lifestyle has definitely changed. Initially we used to do sachat, garat. So everybody used to at home eating together at night, and then proper sleep, early morning get up, do your exercise, but everything is changed now. So actually some people, means the youngsters, they start their day at night because the night parties, then sometimes because of the studies, they are awake for a long time after 12, 1 or 2 a.m. And then they sleep and then they get up late. So this lifestyle plus, the tobacco and alcohol was totally no when we were young. But nowadays it is a prestige issue. So people try to consume, even youngsters, ladies, gents, everybody is in this. So this lifestyle change has occurred, and this is definitely, there's a part because there is an increase in diabetic patients in day-to-day life. Plus now you can diagnose, if you ask some history, घर में किसी को है डायबिटीज, लोग बोलते थे नहीं, लेकिन हमारे दादा नाना चेक भी करते नहीं थे ना. So nowadays people are more aware. So definitely every nooks and corners you get diabetic laboratories, and you check the disease and you may get it. So this may be one of the cause of getting increase in diabetic numbers in our patients. So then basically then how will you diagnose? So diagnosis, the patient, basically we ask the history. Typical what this patient had: increased thirst, increased hunger, increased urination, loss of weight, then lethargy. Everything is a symptom of a diabetic patient. So if patients come with this, definitely we ask for investigations. Plus, you have to remember that around 28 to 30% of the patient, they don't have symptoms. Then how they are diagnosed? During their some routine tests. Like my husband is orthopedic surgeon, so patient come, they had fall or there's some problem, and then we check sugar levels and the sugar is on a higher side. So they don't believe this. How so much of sugar is there? I'm not having any problem. So 30% of the patient, they don't have symptoms, but the routine checkup will show that patient is having diabetes. And then other symptoms like repeated vulvovaginitis, then repeated infections. So this frozen shoulder is one of the part of presentation, because in our hospital, sir sees so many frozen shoulder patients. And what we have seen, because each and every patient now has started doing sugar levels, glucometric sugar levels, and we have found around 15 to 18% of the patient, they are newly diagnosed diabetic. Around 10 to 15% of patients, they are known diabetic, but they have not checked their sugar levels or the sugars are uncontrolled. Because one of the important reason why patients get this frozen shoulder is diabetes. So in normal patient, the frozen shoulder patients are around 5% without diabetes. But if patient has a diabetes, then the chances that patient will get frozen shoulder is around 27.5%. So definitely this is one of the symptoms of diabetes. Then how will you diagnose it? So diagnosis, we do the blood investigations. Fasting and postprandial blood sugar is a standard one. GTT is usually done or may not be done routinely. Fasting and PP is enough. Plus HbA1c will show you how much is the total 3 months average sugar reports, because sometimes the sugars are high or symptoms after the treatment, the sugars becomes up to the mark, normal, but still HbA1c is high. What it suggests that average 3 month sugar is on a higher side. So these people may get frozen shoulder on a can get frozen shoulder. So what are the labels then? The fasting, because nowadays, because of the ADA, American Diabetic Association is changing all their norms, all their criteria frequently. So the recent is that the fasting should be around 80 to 100 and PP should be around 140. PP means postprandial, after lunch 2 hours. Fasting means around 8 to 10 hours of fasting. So these sugar levels are considered to be normal. Then what? If the patient is having up to 110, 100 to 110, it is considered as it's a impaired glucose tolerance or pre-diabetic patients. And we find so many patients having pre-diabetics also. And pre-diabetics, all their chances that if they observe diet and exercise and all, they will be normal. But if they don't observe, they will turn diabetics in the near future. Same with the HbA1c. Initial criteria was, means now the criteria is 5.7 to 6.5 is considered to be normal. Means, it's impaired glucose tolerance. Less than 5.7 is normal. After 6.5, patient is diabetic. So in our country, HbA1c recording is not done so frequently because of the cost. But the sugar levels are done within 50 to 60 rupees. They do sugar levels report. Then various investigations also we advise them. The sugar is not only one thing that will come. It will be associated with the blood pressure. It will be associated with the dyslipidemia, means lipid profile. It may be, especially in type 2 diabetic patient, it could be associated with some creatinine, means urine problem, or it may be because of some problem of ECG. We advise ECG also, cardiac problem, because patient is not aware, but patient may be harboring this complications in them. So various investigations we advise them. Line of treatment. What usually we give these patients? First of all, 50% of the patient, what we advise them, lifestyle is the basic thing, is the basic pillar of diabetes. So what you eat, how much you eat, at what time you eat. So this is very important, and the quantity is also equally important. Plus exercise. Whatever you choose, but some exercise is necessary for at least half an hour. Means aerobic style exercise. In elderly patient, if it is not, then the stretching, then the Shwasa exercises like yoga and Shwasana, like what we advise them to at least have a good control of diabetes from their, what they can contribute. And then the proper stress management, it's, you have to advise them. Plus, what you will tell them, that drugs, some patient may require drugs. If the sugar levels are very high, HbA1c 9.7, sugar levels 300, so we have to start treatment. Usually, when there is a IGT patients, impaired glucose tolerance patient, we start with only lifestyle management. No drugs are required. But, we have to check them. Sometimes people are under, what they feel that madam has not given any medications. So no need to get follow-up for her. But then after 6 months, they turn up and they see that a patient has become friend diabetic. So the frequent follow-up is also required with investigations. I'm feeling well. This is not enough. You have to show us the black and white fasting NPP or HbA1c report, whether you are under control, along with what are the patient's complaints. Plus, what we do is then treatment, what type of treatment, what we can offer them, starting with, just because in diabetes is there because of two reasons. One, there's the insulin deficiency. Second is insulin resistance. If there is a deficiency, then like in type 1 diabetics or in gestational diabetics, we have to give insulin injections. This is the gold standard according to the modern medicine. But in type 2, otherwise for insulin resistance, there are various groups of medicines nowadays available for us. And newer drugs are coming in our armamentarium to treat these patients. Near good drugs like metformin, you all know, biguanides, they are called as sulfonylureas. They are very good because they increase the insulin secretions, so they are useful. But nowadays, the concept is there, you try to give less sulfonylureas and more insulin sensitizers like glitazones, like pioglitazones, or gliflozin, means dapagliflozin, empagliflozin. Then there's so many newer drugs are coming in the market. So these are very useful for controlling these drugs. One more group is gliptins, like sitagliptin, vildagliptin. These drugs. They basically reduces the stress on beta cells. They increases the insulin sensitization. And so these drugs are very useful. So what usually we use, these are the insulin sensitizers in these patients. And then, if need be, we start the glimepiride or sulfonylureas, which increases the insulin secretions in the body. And after that, if nothing is coming under control, or the patient is facing some stress, like patients having heart attack, or patients is having CVA, severe cerebral vascular accident, hemiparesis. So at that time, we have no time, so we have to start with the with insulin injections. Insulin also, there are various types of near insulins are available in the market according to our body's need. How the body produces insulin, that way the newer drugs are coming. Only the thing is that we have that some cost problem. But the basic insulin, which is human insulin produced in the laboratories, are definitely very useful to treat these diabetic patients. Now, this frozen shoulder, what we have said, the limitations, because the limitations are each drug has some of the side effects. So we have to monitor that metformin may get kidney problem, B complex deficiency, but this is a standard drug. 50 years we are using it and hardly side effects are seen in these patients. But the newer drugs like gliflozins or gliptins or incretins, these drugs, what we are in the market, but still people are searching if there is any side effects of this drug. Like gliptin, hardly, but gliflozin, very good. It is very useful to treat diabetes, to overweight patients. Patient is having cardiac problem, congestive cardiac failure, or having renal problem, we can give gliflozin. So this is a newer drug. Some drugs are having some side effects like nausea, vomiting. So this, but we have to keep watch. So what we need is a frequent follow-up. And if there is any problem, what happens with this patient? That patient will tell us that I stopped the treatment. Why? Because I had side effects. But then you have not consulted me again. Because otherwise, we have to stop that drug. But again, the sugar goes high and then the patient comes with other complications. So limitations, that definitely the lifestyle modification, though we say it's a gold standard, but it is not possible for a long-term effect. If it is done, fantastic result. Patients are living for more than 25, 30 years without any complications. But then, and if there is some problem like creatinine going high, or patient is developing some eyesight problem, we need to refer to the specialist. Like patient is known to get retinopathy. So if their eyesight is affected, please visit ophthalmologist. See that, because you can take lesser treatment, you'll be all right. In nephropathy, you can treat patients early. Early reference is definitely better. So we can, we'll try to make them less problematic. There are so many complications. Dr. Kulkarni has said there's so many complications of diabetes, and diabetes is known for its complications. But if we diagnose them early, definitely we can help them to get good quality of life and longevity of life. I think with that, I stop my presentation. And if there are any queries, I'm definitely open for question and answers. Thank
Thank you
you.
so much, ma'am. You have covered all points: etiology, investigations, treatment, and limitations with related statistics and recent advances. Thank you so much to clear all basic concepts like what is fasting, what is BP, and what is HbA1c, and especially thanks for non-medicinal treatment. Thank you so much, ma'am. Please stay with us for further discussion. Now, next, we will end with homeopathic expert opinion. We have Dr. Sarang Rahalkar. He is a professor from Homeopathic Repertory, Motiwala Homeopathic Medical College, Nashik. Welcome, sir.
Hello, everybody. I was very patiently hearing to both the speakers. Both of them are very much expert in their pathies. I know Dr. Mrunalini Kelkar since very long, and I know Dr. Abhay Kulkarni also since very long. They both have focused lot of things related to diabetes, the modern ways, the treating modern ways of how you treat diabetes, what are the latest type of treatments which are coming in Ayurveda as well as the allopathic fraternity. I would like to focus basically related to homeopathy as far as the subject is concerned. You see, homeopathy has a basically holistic approach related to this diabetic treatment, because we not only considered the diabetes as a disorder, okay, but at the same time we also consider a patient or a person having a diabetes. So what we say की आपण जीवनातला गोडवा कुठे निघून गेला. So from that way, we focus to the patient as a person, where not only we see the symptomatology, like the basic symptoms everybody knows, polydipsia, polyuria, polyphagia, or maybe blood with fatigue. Patients complains with some depressive kind of disorders continuously. Patient complains with non-healing of injuries. So there are all type of symptoms by which the patient would come to us. श्रेष्ठा ने जो अभी जो एक केस प्रेजेंट किया, it was a beautifully presented case by her. She had covered all the aspects, right from the mind, the mental aspect of the person, जहाँ पर वो anger, winger, वो सब उसने cover किया, to all the aspects related to the pathology, related to frozen shoulder and everything. At the same time, I would like to focus that she has treated it homeopathy along with the conventional, that is allopathic line of treatment. We have to really consider, because diabetes is a disorder where you find so many aspects are involved, right? So we have to integrate all the pathies to really focus on the treatment, because sometimes it is helpful for all of us to really sit and at the one single platform and discuss out the things, and we have to standardize the things and come out with a treatment so that the patients get benefited. As far as we treating homeopathy, as I told, we focus on a patient as a person, not only the diabetes itself. So when we also see the psychosomatic aspect or the personality feature of the person. That is very important, because in homeopathy, we believe in individualization. Individualizing a person from one person to another, that we say no twins are alike. So a person having a diabetes has gone through so many things in his life. Not only there might be a genetic inheritance, not only there might be stress, there might be so many other aspects. So we focus basically why the person is having diabetes itself. So whether it is related to heredity, whether the genetic factors are considered or not. The second thing is, definitely we understand the juvenile diabetes and type 2 diabetes. But at the same time, we have to also see the certain important facets of the person, because giving a specific medicine for diabetes, as far as the homeopathy is concerned, you see there are so many medicines like Syzygium jambulinum, जो अभी श्रेष्ठा ने भी prescribe किया था to the person. But at the same time, we have to see the individual suffering from diabetes and give a specific constitutional medicine to that particular person जिसमें imbalance हुआ है and diabetes जो उसके वजह से हुआ है. So the cause, the ailments from what we say are very important. Why the diabetes has occurred. So we have to consider these things first. We have to understand the cause of the disease. We have to understand the patient suffering from the disease, because every person would present to you in a different manner. For example, I would give you an example. A person coming to me and telling me that sir, अभी diabetes जो हुआ है मुझे, अब तो मैं गया. Okay, but another person is coming to me. He is not absolutely bothered. He had a diabetic foot and he was not bothered. Actually, surgeon had advised him to, अगर ये ऐसे रहा तो 5 दिन में तुम्हारा पैर काटना पड़ेगा. Okay, but he was been brought by his brother. His brother was 70 years old and he was 65 years old. And he was been brought by his brother and he was telling me इधर उधर के बात कर रहा है. But he was not bothered about his foot, which probably he would need an amputation, जो सर्जन ने बोला था. So ये जो अप्रोच है, कि हर एक पेशेंट का अप्रोच वो डिसीज से रिलेटेड अलग है, and that is what the homeopathy considers. At the same time, we focus on the miasmatic aspect or the pathology of the disease, because diabetes से related there might be a simple things which occur like पॉलीडिप्सिया वगैरह से स्टार्ट होता है, पॉलीयूरिया, पॉलीडिप्सिया, पॉलीफेजिया, देयर माइट बी फटीग व्हिच आई टोल्ड फर्स्ट. इतना भी हो सकता है जो हमको समझता है कि वो प्लीज गेट योर ब्लड शुगर डन, प्लीज गेट योर HbA1c डन. सो वी अंडरस्टैंड कि बाबा इससे वजह से डायबिटीज हुआ है, बट द टोटलिटी ऑफ सिम्टम्स जो है ये इंपॉर्टेंट रहेगी. दूसरा बात, द सेकेंड थिंग इज कि when you focus on diabetes, you have to focus on the miasmatic aspect. वो soric, what we see in homeopathy are the three things: sora, psychosis and syphilis. Okay, जैसे आयुर्वेदिक लिटरेचर में अपन वात, पित्त एंड कफ से रिलेट करते हैं ना, तो वैसे ही देर आर दीज थिंग्स विच अकर इन द डिसीज. Sora is the initial stage of a disease. Any disease starts with soric state. Then it goes to the psychotic phase, which is the lingering phase of the disease, which might be lingering for very chronically for many years. Okay, and then the third thing is the syphilitic state, where the destruction starts. So ये जो तीन stages है, इसमें अपने को we have to see the diabetic pathology. Has it just started, जिससे पेशेंट जो है वो थोड़ा सा इधर से उधर हुआ है, जैसे केरकर मैडम ने अभी बोला कि बाबा इम्पेयर्ड ग्लूकोज टॉलरेंस में है. सो ही माइट नॉट नीड मेडिसिन, ही माइट नीड दैट ही शुड अंडरस्टैंड कि उसने कॉन्सेंट्रेट करना है एक्सरसाइज पे, उसने कॉन्सेंट्रेट करना है उसके डाइट पे, कैलोरी मेंटेनेंस पे कॉन्सेंट्रेट करना है, उसको योगा, प्राणायाम वगैरह ये सब जो चीजें है उसके ऊपर कॉन्सेंट्रेट करना है. पर जब भी ये पैथोलॉजी और आगे जाती है, इम्पेयर ग्लूकोज टॉलरेंस में वो नहीं रहता, तो उसके आगे जब भी जाता है, व्हेन यू फाइंड द शुगर लेवल इज इंक्रीजिंग, इट इज प्रोबेबली नॉट गेटिंग कंट्रोल्ड. 300 के ऊपर शुगर लेवल जा रहा है, वो कंट्रोल में नहीं है, डेफिनेटली ही वुड नीड द मेडिकेशन along with it. So it becomes a tripod regime, जहाँ पर आपको फूड, जहाँ पर आपको एक्सरसाइज, जहाँ पर आपको मेडिसिन, ये तीनों की जरूरत रहेगी. एक भी पैर जो है अगर खींचा तो वो जो स्टूल है वो गिरने वाला है. सो हियर कम्स द बेसिक इम्पोर्टेंस कि वो पैथोलॉजी क्या है. इफ यू अंडरस्टैंड द पैथोलॉजी ऑफ दैट पर्टिकुलर डिसीज, यू वुड डेफिनेटली ट्रीट द पर्सन. और जो कॉन्स्टिट्यूशन है, होम्योपैथी फोकसेस ऑन द कॉन्स्टिट्यूशन ऑफ द पर्सन. Homeopathy focuses on the individualization of the person. Homeopathy focuses on who is suffering rather than what he is suffering from. Okay, so ये जो तीन aspects है, ये तीन aspects सबसे ज्यादा important रहते हैं, because that would make the difference in selecting the remedy. क्योंकि there are so many myths related to homeopathy कि ये काम करता है कि नहीं करता है, वो कैसे काम करता है, कितने लेवल पे काम करता है. डेफिनेटली वी हैव टू अंडरस्टैंड कि अपना लिमिटेशंस कितना है. इफ यू नो कि बाबा गैंग्रीन के स्टेट में पेशेंट गया है एंड यू आर वेटिंग जस्ट कि नहीं हो जाएगा, सो दीज आर टॉल क्लेम्स, दिस शुड नॉट बी डन. पेशेंट हैज टू बी गिवन इंसुलिन. ओके, कॉम्प्लिकेशन से पेशेंट हैज टू बी गिवन इंसुलिन इमीडिएटली, उसका शुगर लेवल डाउन आना ही चाहिए. But for the longer maintenance, for a maintenance and a very good lifestyle, you would find that homeopathy would work wonders. We are treating the patients of diabetes like anything, and they are doing very beautifully. So this मैं फिर से focus करना चाहता हूँ. It is an integrated approach where everything एक साथ में आना चाहिए, and then we have to treat the person. The important thing is lifestyle management. The second thing is there are some medications which has to be given whenever necessary. The third thing is you have to consider the patient as a whole, not only diabetes, because diabetes जो है so सिर्फ sugar level नहीं बढ़ाता ना, वो complications लेकर आता है. वो cardiac level पे complications लाने वाला है, वो न्यूरोपैथी लाने वाला है, वो रेटिनोपैथी लाने वाला है, वो liver से related metabolic disorders लाने वाला है. So there are so many aspects which we have to cover. So we have to see to it that we are treating the person, not only the diabetes. Okay, so these are the things. There are so many specific medicines, that is organ medicines, there are phosphoric acid, you have uranium metallicum in homeopathy, we have Syzygium jambullinum mother tincture in homeopathy. ये जो मेडिसिन है ये फिजिक लेवल पे काम करते हैं, ये इमीडिएटली ब्लड शुगर लेवल जो है वो डाउन करने में इम्पोर्टेंट है. बट एट द सेम टाइम वी हैव टू सी दैट यू हैव टू फोकस ऑन अ कॉन्स्टिट्यूशनल मेडिसिन. वो पेशेंट को जब तक प्रॉपर मेडिसिन नहीं जाएगा related to all the totality where all the symptomatology of diabetic pathology has been considered, जब तक नहीं जाएगा तब तक पेशेंट उसमें से बाहर नहीं निकलेगा. So this is the basic thing, this is the crux, because we have to understand बाकी पैथोलॉजी है ये जो दोनों एक्सपर्ट्स ने जो बताया वही है, it is not different, but at the same time कहाँ पर डिफरेंस है? डिफरेंस is related to treating the patient as a person. सब गोड़े 12% नहीं है इसमें. इसमें if I am suffering from diabetes, I as a person am suffering from diabetes, मेरा वो डायबिटीज से रिलेटेड देखने का नजरिया अलग है, वैसे हर एक पेशेंट का अलग रहता है. So we have to individualize a person and then give a homeopathic medicine as a simillimum, and then it would work wonders. Okay, so this is what I would like to emphasize. And we have to understand the pathology, we have to understand the clinical aspect of diabetes, we have to understand where we have to actually treat the person and how we have to treat the person. We have to understand our limitations. At the same time, we have to understand अपना upper hand कहाँ पर है, क्योंकि we have to give a very good life to a diabetic patients. जो अगर good life जितना दे सकते हैं, that would help the person, because ultimately diabetic pathology कहीं ना कहीं बाद में affect करने ही वाली है patient को. But we have to see the quality of life, we have to see how we can improve the things as far as the patient's lifestyle is concerned, making patient aware related to diabetes. So ये जो चीजें है ये सोशली भी होनी चाहिए, एज फार एज स्पेसिफिक ट्रीटमेंट में भी होनी चाहिए. हर एक फिजिशियन का ये अप्रोच होगा तो प्रोबेबली इट वुड हेल्प एवरीबडी रिलेटिंग विद the diabetes, not only diabetes, any disease I would say. But this is what I would like to focus. As far as homeopathy is concerned, these are three things which I told, again I would repeat. Individualizing a person related to diabetes, understanding the cause related to diabetes, treating the patient specifically for diabetes as well as the patient as a person, and giving him the constitutional simillimum medicine, which would help the patient to improve his life, at the same time controlling his blood sugar levels. Okay, so this is what, and I am stopping it now.
Okay, sir. So miasms and overall behavior is more important, right?
Miasm is important to understand related to pathology and at what level the person is suffering from.
Okay. So nice discussion. Thank you so much, sir. Now this platform.
And I thank university for giving me an opportunity to speak to you, madam, the इतना promptly relate करने के लिए, and allowing us to really share something related to homeopathy, which would help everybody. And all my fellow students, thanks for coming and listening to us. So it is my pleasure to speak and give my opinions. Thank you so much.
Thank you, sir. So now we can discuss openly. We have experts, 3 experts with us. And Dr. Shrestha?
Yes, ma'am.
Yeah. Do you have any queries?
No, ma'am, not right now.
Okay. Yeah, Purva? Unmute. Dr. Purva? No, she is not audible. Okay. So, if anything Anybody want to say anything about diabetes? You can say. You can share your experiences. Okay, so now we will end this session. Thank you so much, Dr. Mrunalini Kelkar ma'am.
Thank you very
That's-
much, ma'am.
Yeah, thank you, Dr. Abhay sir, Dr. Sarang sir,
Thank you so
Thank you
much.
very much, ma'am.
yeah, Dr. Shrestha for very nice case presentation. And last but not least, all audience, all participants for your participation. Yeah, thank you.
Congratulations on successful handling of the event, madam.
Yes.
Yeah, thank you, sir.
I take your leave then.
Yes,
Thank
sir.
you.
Thank you. Thank you so much.
Thank you, Sarang.
Thank you. See you. See you soon.
See you. Bye.
Thank you, Dr. Sarang Dalgar.
Thank you. Thank you
Thank
so
you for
much,
sharing your
madam.
views on, yes, homeopathic medicines. And what you said is right, that we have to be together
Yes,
in
yes,
the
yes.
treatment of
Absolutely.
diabetes. You know, we are not different, only
Yes.
Yes,
different
yes,
views we have,
absolutely.
but
Yes.
still we can, yes.
No, there are some many similarities. As far as
Yeah, I
the
know.
body is concerned, the therapy might be different. But
Yes,
the diabetes तो diabetes ही है ना, तो
yes.
तो उसको वैसे ही treat करना चाहिए. We need
Right, right. Nowadays, there is an individualized treatment in modern medicine also.
Yes,
We
yes,
can
yes.
individualize the
Absolutely.
treatment according to the age, according to the symptoms, according to
Absolutely.
the.
Absolutely.
Exactly, exactly, exactly. Even Ayurveda also considers all this. Right?
Yes,
Yeah.
yes.
Yeah.
Ayurveda has a deep knowledge in diabetes. So
Absolutely.
many
absolutely.
years.
So many years. Yeah.
Uh-huh.
Chalo.